Hello and welcome to the Axiom webinar follow-up. My name is Holly Foxworth, and today we're actually going to kind of cover some additional topics that we didn't get to this last week. For those of you who may be new or stumbled across our channel here on your feeds, I did want to just introduce myself. I'm Holly Foxworth again, and I'm one of the registered nurses and also the marketing manager for content here at Axiom. So we have two people that are going to be joining us actually from our panel today, which were on the webinar for this last week. We had Dr. Scott Cherry, who's our Chief Medical Officer, and we also had Dara Wheeler, which is our Chief Marketing Officer. So they're definitely going to introduce themselves momentarily. I did want to just go over some brief information before we get to that point, just kind of give you a background in case you are new, is that we do these every other Thursday. So the week prior, we do a webinar, and those are live events. They cover all of the different topics that would be related to employee health or safety, etc., things that are really going on right now in the workplace. And then the following week is whenever we take that, we do the live streams. And so we take your additional questions that we weren't able to get to, but definitely want to make for sure that you get those answers. So we started a new webinar series this last week, which was lasting effects of lockdown. And we specifically covered some of the COVID long hauler symptoms and what that looks like, what your role may be as an employer, what some of the special needs that they may have for medical management, et cetera. So it was a great topic. Dr. Cherry and Dara both did a great job. And we're going to pick back up with some of that today, some of the highlights, and then take the questions. We do have another event that's scheduled for this next Thursday at 1:00 p.m. Central. And that one is actually going to be specific to post-COVID psychosis, recognizing, responding in the workplace. So I'm sure you all have seen on the news this week in the highlights there's been multiple shootings that have taken place. That's not to say that these specifically are related to that, but we do feel like there's a lot of issues from a mental health perspective that our population needs help with. We need to understand that better. And so we're going to jump into all of those and talk about what that may look like from an employer standpoint. So at this point, I'm going to go ahead and turn it over to Dr. Cherry and also Dara for brief introductions, and then we'll get started with the webinar. Dr. Cherry, you want to go first?
Sure. Good afternoon, everyone. My name is Scott Cherry. I'm Axiom's Chief Medical Officer. I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting employee and population health for the past 15 years, and it's a pleasure to be with you.
Oh, thank you. Awesome. And Dara, would you like to go next?
Yes, thank you for having me, Holly. I apologize for the very casual way I'm dressed. It's opening day in baseball, and so got my Dodgers pride going today, loud and strong. So thank you for having me, and I'm happy to be here.
Oh, that's awesome. Well, again, thank you for joining us. We appreciate you both rock stars for sure whenever it comes to the follow-ups here and getting them information that's needed. Before we jump into those questions, I did want to just bring up the topic of the Johnson & Johnson and some of the dosages that may not be as accessible now due to some of the things that occurred there in their distribution facility. Dara or Dr. Cherry, is there anything that either one of you are aware of or could kind of shed some light on in terms of what maybe we need to plan for if we don't have access to those additional doses?
Looking into that, it seems like, the majority of those vaccines from Johnson & Johnson were produced in the Netherlands, but a partner started producing here in the US, and it seemed like there was some issues with the actual creation of about 15 million vaccinations. So fortunately, that was caught in quality control and it was not released to the public. So my understanding is that the doses out there previous to this are fine, but that does present, a delay in the supply chain for the Johnson & Johnson locally or nationally here. And so, I think there's not a lot of details about the production facility, but it looks like they did catch that and are remedying that now. But just talks to the scale of what's trying to be undertaken here with so many doses being created in a really short time period. So short of not getting your vaccine in the next week or month, continue those protective efforts that we've been discussing with your environment, with your own personal hygiene, and not going into work or public when feeling ill. Those are really the key aspects, I think, to kind of that innate do no harm to yourself and others at this point. Dara, I don't know if you had seen anything else with regard to that.
No, that was about the extent of what I saw as well. At Axiom, we're a little disappointed just for our own reasons of trying to manage supply chain, and we were hoping to have a lot more of the Johnson & Johnson vaccines here shortly. So we're still pushing forward with Moderna and Pfizer vaccines, but we were excited with opening up of a lot of the supplies and being able to get that to our employees and to our clients' employees. So we'll see how that goes in the near future.
Fantastic. Yeah, definitely. And just to follow up on that, it looked like that we had some news this last week about the vaccines being okay for up to the adolescent years. Is that your understanding as well, Dr. Cherry?
Yes, I think there was a press release in the last day or two about showing, that same high level of efficacy. So the vaccine's working in this age group 12 to 15. Prior to that, the vaccines have been only approved at 16 and older. And so I'm looking to make sure there's a statement by the FDA to kind of re-update the emergency use authorization for the vaccines at that age group.
Fantastic. Okay. Well, thank you for that update. I appreciate it. Well, jumping kind of into the questions that we got to, I think that we have several that are here that speak to or asking about, some of the stats that we were seeing in Texas, and then also the infection control. But we'll get to those a little bit later. But in the very beginning, it looked like Maddie was asking about the study that had said that about a third of the population that had COVID continue to have symptoms. And so she was asking, is that accurate? Do you feel like that's an accurate description or representation of those who could have long hauler symptoms?
I think that's accurate, but it needs to be maybe a little bit more specific. So I believe that study, it's 1/3 of hospitalized patients, not of any person that actually gets infected. So kind of the big picture is mostly about 95% of cases usually do not require hospitalization, 5% do. But about 1/3 of hospitalized cases do seem to have longer effects. In fact, the CDC guidance for discontinuation of social isolation actually go out to 20 days for those that are hospitalized, not 10 days, which was kind of the working guidance for ambulatory cases or cases that didn't need hospitalization.
Okay. Is there anything that you were wanting to add to that?
No, I think Dr. Cherry said that well.
Perfect. Okay. All right. Let's see. Rachel was the next one. It said you'd mentioned that there were several doctors and clinics that were treating long hauler problems. Do you know how I could get access to them?
I'm not aware. I know this is really just starting to be a focus for me. I'm not sure if Dara or Holly, you've got better information to address this question.
Yeah. Dara, if you want to go ahead, or I can go ahead.
Go ahead, Holly.
Yeah, the information that I've looked at to this point, it does look like there are several clinics that they've put together. Obviously, that's going to be a topic of research moving forward. But what would be interesting, if there's a lack of facilities and resource points there, would be if we could somehow cover these with telehealth, communication methods. Maybe we could reach a larger population there. Dara, did you have something you wanted to add to that?
No, I think it's a good point. And I think this is going to be where we need to get creative a little bit in the meantime. And so we're always willing to help people research and point them in the right direction. Even if we don't know the answer, we can at least get somebody a resource that may know the right answer. We have a lot of good people that could help. And so I agree with Holly. I'm seeing more clinics come up to address this issue in the market, but I still think we're in early days, and if we can help fill a gap, we're happy to do that.
Absolutely, I agree. Yeah, and we covered just kind of some of the basic symptoms that we were seeing here, but could maybe, Dr. Cherry, could you just kind of give us a brief recap of some of the common symptoms in case there was somebody that did not attend the webinar or didn't catch that part last week?
Yeah, so coronavirus infection, kind of, I think historically we've thought of it as the common cold. And now with COVID-19, it's really considered more of a multi-organ infection versus just the respiratory system. So potentially you have kind of just big body parts or big organ systems, the psychological or neurological system. So you can have headaches, brain fog, a lot of mental health kind of symptoms that are probably common anyway, but with regard to mood, anxiety, depression, then you go down to kind of the cardiorespiratory system. You can have kind of like a prolonged cough, shortness of breath, chest pains, kind of fatigue from physical activity. There can be some lingering effects in the kidney system where that's filtering your blood to create urine. And then one that's actually kind of fairly common within this is the blood or hematologic system, where people potentially have this higher dysregulation of clotting. So they may get more clots than usual. You can get them in the peripheral, like in deep vein thrombosis, kind of in the calves, but most worrisome would be in the vasculature that feeds your heart and lungs. And so the medical term is pulmonary embolism. And that's probably where a lot of unexpected deaths have come from. So those are kind of the big organ systems.
Definitely. And we had talked also about just kind of the stamina and endurance abilities maybe of employees that perhaps had COVID and then are trying to return to the workplace and seem to be subjected to some of these continued symptoms. So do you have any thoughts in terms of what type of testing or what type of monitoring that needs to be done for some of these employees that maybe would have a safety sensitive position?
Yes. So if it's safety sensitive and physically demanding, you can build a functional capacity evaluation from a physical demands analysis. Mm-hmm. And sometimes employers don't have that, so working from position descriptions is suffice. But other kind of generic assessments of maybe even cardiovascular fitness, like a Chester step test or kind of a 6-minute walking test, kind of seems to be fairly sensitive for general issues with fatigue. Everyone has baseline fitness everyone has a baseline fitness, so you can have different ranges. But if someone is recovering and they're symptomatic, then this is a good way to see how they're improving. From Axiom, we always recommend kind of a pre-placement exam. So you get a baseline of function, whether it's, pulmonary function test or physical demands kind of capacity. But, doing a 6-minute walk test or a Chester step test kind of gives you an idea of baseline cardiovascular fitness. And then you can compare it over the years or after, or for return to work from illness, whether it's COVID or others.
Good information. All right, let's see. Brandon had the next one, and I don't think we've gotten this question before, which was great. Can kids be long haulers, or would that just be for adults?
I haven't seen really kids be identified as long haulers, but that doesn't mean that is the case. Kids have been really interesting with COVID, and this is from a population health perspective, not an individual case. So I do think we will see cases of children or young adults have severe cases. But in general, from a population health perspective, kids have really, fortunately, not been as affected as other populations, within the country or the world. And so there just may not be enough data to know about long haulers in that situation. So I haven't seen anything, but it doesn't mean that's necessarily the case. But I don't know if Dara, Holly, you've seen any studies or anything like that for kids at this point.
I haven't seen anything. Dara, have you? Yeah. No,
I think it's an interesting question, and one that we'll pay attention to, but I've not seen anything come out about children. And I think we're still a little bit unsure of the disease in children. I still think we don't really know all that much, and we're learning a lot as we go through this. So it'll be interesting to see how it progresses.
For sure, yeah. And Jason, did we miss one of the questions that was in there? If so, we can put that up there and we can take it. Yeah. So Pat was asking about can COVID lung scarring be reversed, or would it be a lifelong problem?
I have heard of persistent lung issues, lung scarring. I haven't seen kind of better, more specific studies about the characterization of the scarring. So you can look at the lungs through, CT scans or lung biopsies to kind of see what's the pathology, what's kind of the negative effects, because that can give you some ideas about the remedies. All that I think we've heard so far from the medical literature is kind of this is what's going on, but we're not sure what's next. But there's classic lung diseases in occupational medicine that can be reversed, and then there's those that can't be reversed. So I'm not sure if where this is headed. My gut instinct is this could be reversible, just because it's an infectious agent. And so maybe the damage is coming from either the infectious agent or our immune response fighting the infectious agent, whereas a lot of the non-reversible occupational lung diseases come from toxins, which just kind of really create a really bad scar that isn't amenable to regeneration. So, but those are just some kind of thoughts to broadly present to the group here.
Yeah, great information. So do you think that maybe like the steroids, whenever they're taking steroids to treat that could help with the reversal process, or what? What do you think?
Yeah, so steroids is one of the remedies or treatments that have shown really good outcomes for those hospitalized, and especially going into the ICU. I know there was so much going on with a lot of different therapeutics, but whenever you hear of steroids, it's the like prednisone of that nature. What really their function is to actually calm down our own immune response. And so it's a way of kind of, if you think of an infection in your body as kind of a battleground with a lot of destruction, of course, of the infectious agent, but it also is occurring in the battleground is your body. So you have a lot of destruction of your normal tissues as well. And so I think it's a balance for ICU docs to dose the steroids to where you want your immune system strong enough to be deadly towards the infectious agent without causing too much kind of sideline or peripheral damage to the rest of the body. So it's got to be a tough question about that. So we might have to get Dr. Kabir online to talk with us in the future about this, because I'm sure he's still on the front lines of the ICU.
That's a great point. Yeah, that would be good. We'll have to touch base with him and get his thoughts too. Excellent. Okay, so I think Carlos was the next one that we had that was asking about brain fog. What is brain fog? How would you get it? And could it make employees seem as though they were under the influence of drug or alcohol?
Yeah, I think brain fog is kind of a non-medical or layman's term about when we're not thinking as sharply as we normally do. So for instance, if you're sleep deprived, I think there's some great studies that show if you're sleep deprived 24 hours, it's akin to being drunk, so to speak. So anything that can affect your cognition, so your ability to make executive functions, making decisions, And so, yeah, exactly. It can be like you're under the influence of a sedative. And I don't know if there was a third question there, but yeah, basically brain fog is, your mind is slowing, things like that. So that is an issue with, again, I always go back to safety sensitive work. If people are working around dangerous machinery, working at heights, or working on anything that can affect their safety, their coworkers' safety, or the environment, brain fog can be an issue. When you look at mass casualties or corporate industrial accidents, usually there's multiple. We talk about multiple layers of protection for COVID, but usually there's multiple layers of safety around safety-sensitive work. But you want to make sure you're addressing every layer as best as possible. So the personal responsibility about their health, should be really taken on from every individual, but also the organization make allowances to also test or check in with their employees frequently.
Absolutely. Yeah. And just kind of at least knowing what that baseline is for each of those employees to be able to recognize some of those changes should they occur.
Mhm.
Yeah, and I think it's like what we've always talked about with any behavior. You just keep paying attention to the trends and ask questions and support employees as you get those answers. So it may be, if they're presenting symptoms that you're not really sure what's going on, you're within your rights to ask if they need help and to try to support them in that. And then also just pay attention to those behaviors that you can look at from a trend perspective.
Absolutely. Yeah. All right, let's see. The next one was from Patty that was asking, oh, this is a good one. So I'm from Texas and we're fully open with COVID-19 cases going down. So their numbers trending down. Have any of the, let's see, why is the CDC telling Americans that we should fear a fourth wave?
So there's a couple of reasons. So for one, we would expect, waves of infection as it kind of moves throughout the population and as we open up. I think what's probably driving this primarily now is kind of the vaccination status completion of the country, which isn't very high yet. But then with variants potentially eluding the vaccine, you could have a fourth wave. Right now, our current understanding is that the variants do not elude the current vaccines, but there was an interesting study recently put out that probably over 70 epidemiologists worldwide are kind of, their general consensus is that they do expect variants to elude the current vaccine within a year. So, that's kind of an interesting dilemma or challenge,
Mm-hmm. So in that type of scenario, then would we be looking at updating boosters then to address that, or what? How would that be managed?
Yeah, my understanding, as I'm not a virologist, but an RNA virus are like a coronavirus and flu. They can mutate quite quickly. The flu, for decades we've been vaccinating annually for variants, and so it looks like coronavirus is going to be akin to that, at least to my understanding as a non-virologist. At least that's kind of where things are pointing to, because we're already seeing significant variants. Based on these epidemiologists, which epidemiologists are physicians or non-physicians that specialize in the trends in population health. So what's actually happening to different populations. across time. So it's interesting to see such a large consensus across the world,
Yeah. And do you feel like that we've seen that if there was going to be some trends that were could be attributed to some of the spring break travel, do you think that we began to see those yet, or we should still be monitoring and looking for some spikes?
Yeah, I keep a kind of a rolling look every few days on kind of the national average of infections and then of the death rate here in the U.S. and then especially in key states and cities that we have large client populations that we manage. Fortunately, right now we've plateaued well below this huge spike we saw during the holidays, but we're still at a fairly high level of about 70,000 cases a day nationally, with 1,000 deaths per day. A study that kind of got my attention recently, our CEO shared with me over the weekend, was how Brazil really isn't doing quite well, and they seem to have a very high death rate from which I would have predicted. So they're only a 200 million country population with about 3,000 deaths per day. So if we compare that to the U.S., that's at least a third bigger at 300 million plus. We have 1,000 deaths per day. So that's really not a great sign. And the genomic analysis of the variants called P1 in Brazil seems to be the dominant strain there. And so I'm just kind of watching and waiting to see how potentially our death rate may be affected, or obviously the infection rate. So.
And this kind of slightly off topic here, but Dara, you shared a great article this week that just kind of spoke to the impact of Texas and some of the decisions for the mask and what that meant for the economy. Could you maybe just kind of give us a quick update of what that was?
Yeah, I was going to talk a little bit anecdotally, two interesting things. To Scott's point about some stability that we're seeing in case numbers, we are starting to hear from some clients that have seen a lot of stability over the last 3 weeks in March with either zero cases or really low case numbers. And they're starting to see over this last week a spike again. So I think it's very location dependent, depends on what cities and states we're talking about. But in some areas, we are starting to see an increase of cases again, and we're not quite sure if that's with variants or if that's with just behaviorally, like Holly mentioned with spring break and what's going on, or with some of these mask mandates that, or just behaviorally, we're all really excited that we have vaccines now and we all want to go back to some normalcy, right? So we'll see a little bit more about whether these behaviors are changing or whether the variants are causing some increases. One of the things that's interesting that I found out, there's two extra things. The first thing is that we work with a lot of labs in the United States and partner with them. They are starting to be able to report on the variants. And so when we get lab results, instead of just detected for COVID, we are going to be able to get the detection for the variants and understand what we're seeing in the populations that we're managing cases for. So it'll be very interesting to see how that data starts to come through for our clients and the populations we manage. And we manage such a large amount of employees and populations that has some meaning within it isn't very small populations. These are large populations, and we are testing a lot. So it'll be, as this data comes through, we're going to start sharing it and seeing how variants are spreading in different areas and what that means for our positivity rates. The article Holly was talking about, one of the unintended consequences I heard about through an article in Texas was that as things are opening up, a lot of businesses are really excited to get back to some sort of economic normalcy. One of the unintended consequences was in the hospitality business, because a lot of events in places like Austin and Houston, where you have big hotel areas and convention centers and people want to come back to in-person events, that because of the state opening up that mask mandate, that they had a lot of cancellations. And so in the hotel industry, they started getting a huge spike in cancellations for these events because people from out of state were concerned about traveling to Texas with the lack of masks or the lack of control for masks. So even if you are a business in Texas that feels like masks are important and you want to continue that because for whatever reason you feel like this may still be critical for us, or maybe something more long-term as a solution, with the behavior in the state of Texas, it is very difficult to require people to come in with a mask or to enforce that through these various businesses. And so the hotels that they actually quoted, they quoted a hotel locally in Austin. It was a Hilton hotel that had said that they were losing hundreds of thousands of dollars a day because of these cancellations.
That burns. Yeah, it stings a bit. For sure. Well, thank you for sharing that, Dara. When you had shared that, it just, I don't know, it was really kind of an eye-opening experience. And you're thinking, I get it. I get what they're saying. And I get the concern for safety and wanting to make for sure that you're going to a safe place that's going to have the appropriate preventive measures to keep you from getting ill.
Yeah, I think it's going to be interesting as we we navigate through this. This is all on both sides is really tough to navigate, and so there's going to have to continue to be conversation and information shared. And I think this theme, I kind of roll my eyes because Scott and I and Holly, we all say this numerous times. We need to be careful about where we get information from. There's so much out there, and it's hard for an individual to kind of weed through that and understand it, or understand what they should be worried about or focused on. And so there's all these stories and all these things, and it's hard for an individual to kind of think through this. And it's, as we think about that, your own risk, your own ability to manage risk. And I think that's what, the message from Dr. Cherry has been from day one. You have to really think about your own tolerance for risk. As we work with clients and organizations, it's the same. What is their risk tolerance? What are they willing to take on? So, it's important to consider.
Absolutely. Yeah. All right. We've got two more questions. I know we're kind of running slow on time here. The next one was from, let's see, Larry, who was asking about what should we be doing in preparation for returning to the office? Have any of the previous recommendations changed, such as restricted occupancy, no coffee in break rooms, social distancing, et cetera? We've had a lot of questions actually that I've came across wanting to review yet again what some of those precautions should be as they're looking to return to the workplace.
Seeing this question, what popped into my mind was kind of what we've learned in patient care, which is this principle called general precautions. Whether I was a medic, like doing blood draws or IV starts early in my career, or doing procedures or direct patient care later on, you treat every patient the same, but you protect yourself with kind of gloves if you're going to be doing blood or bodily fluids and things like that. So, maybe that's the way to think about things at this point, so early on in this pandemic, is that we're still learning a lot about how to address this, how the vaccines are going to be handling infectiousness or carrier states, but especially as variants kind of will start churning out from the pressures of vaccination or just kind of natural selection. But maybe all of the protective efforts that we've been discussing is considered your general precaution, so your general readiness, and then you can tweak once really profound reinforced knowledge is known about the effectiveness of each one individually. Maybe those are my thoughts at this point.
Yeah, good information. And we can actually put together some content too to go out this week to kind of serve as reminders for that. So I'll make sure and put that on our list so we can get some of that out there. All right, the last one, and this is a big one. We've seen discussion of this, and you've seen that it's kind of almost taken on a political angle here on how it is that you feel. But Andy was asking, is the federal government developing a health passport, and would it be required for travel?
Dara, would you mind taking that? I know you've spent a lot of effort on that. I'm probably lagging behind on that part.
Yeah, I think this is controversial for a lot of reasons right now, just because it's it's such individualized data and personal data, but what we are starting to see, just from my perspective, is an incentive to receive the vaccine because of things like travel and showing current vaccination status. So the government has been exploring with some private providers, creating a digital health passport and being able to have that documentation readily available. Axiom's Check and Work app operates very similarly. So we've got the ability to provide that data if we're managing the vaccine programs for our clients. It's very similar in a concept, but I think the big controversy right now is the requirement piece and requiring individuals to have this. Whereas in the US, when we've had big vaccine rollouts, we've not typically made it a mandatory program. And so this is getting to be into a realm that I think is, there's a lot of questions being asked about how we do this and why, and how people's private information gets shared, and it continues to be, something that's at the forefront. But I do see more and more incentives for individuals to have this information readily available because of things like travel, cruise lines, which is Holly, near and dear to Holly's heart. And then as other things open up with businesses, and a lot of it goes back to risk. If organizations are taking on the risk of having populations physically in a space, they want to know what that risk looks like. Now, it does, like I said, it does open up a lot of questions. But if you think about the fundamental reason that it exists or why people are talking about it, it's that risk mitigation strategy that organizations, including our federal government, are trying to put into place.
Absolutely. Yeah.
This isn't a novel approach to management of health, of influxing employees. I've been affiliated with programs where when we send employees to different countries, a lot of times they'll need a statement of health at minimum by a physician, usually like yellow fever certificates for certain countries. And so some countries even have exclusions of certain diseases, things like that. So at least in the employment space for expatriates going to other countries, like we have jumped through significant hoops. But I think this as a standard for anybody, not necessarily just for work, but for play or personal, I think it is another paradigm shift, so to speak.
Good information. Well, I think that does it for the follow-up questions that we had. Any closing remarks from either one of you before we wrap up?
So I'll just kind of reiterate something I think is not overly presented, is that we're talking usually about external protective measures in general, but really to address your own personal health is absolutely key in being resilient for COVID and for many other diseases. So really try to develop a relationship with your personal health physician and detect, get a physical if you can, look at all the chronic medical condition screenings, cancer screenings, and now is the time better than ever to address your personal health.
Very true. Good information. Dara?
Oh, that's great reminder, Dr. Cherry. And I do think that we all need to go back to some of the fundamentals of our own health, making sure we're getting our good sleep and protecting ourselves against this disease and any others that we can. And I do think, we'll talk more next week about the psychological components of this, but I do know that Dr. Cherry is a big believer in sleep being one of the most outstanding ways to prevent some of these diseases, and including some of the psychological concerns as well. And he mentioned it earlier with the lack of sleep can portray quite a bit of symptoms in individuals. So as Americans, there's been a lot of talk about all the negative things we've experienced this year. And I think we need to go and kind of go back and think about some of the positives. And I do think that for some people, there have been a lot of positives this year. They've potentially been able to spend more time with family than they ever have before. And we could debate for a while whether that's a good thing or not. But I do think that's been an interesting thing, and maybe we've slowed down a little bit as an organization or as a company, as an organization. I don't think that's true for everybody, and of course, this is very individual. But we need to kind of revisit what it means to be human in this day and age, and help try to pick up some of the good things that we can out of this.
That's exactly right. Absolutely. Well, guys, thank you so much for joining us today. Again, if you haven't already, you can get the registration information for the post-COVID psychosis, recognizing and responding in the workplace, the webinar that's going to be this next Thursday at 1:00 p.m. Central. So you can get that by email. So look for it there in your inbox. You can also find it within our social media channels. We put links there. You can get signed up. I know it's kind of yet again another kind of somber topic that's here, but it's really important. And I know that we never think that we're going to find ourselves in some of these scenarios, but it would mean a significant difference in what that outcome is going to be, whether or not you're educated and you know what to look for and what to do. So thank you so much. I appreciate it. Also, if you will send us your questions for the next town hall, you can do so at coronavirus@axiomllc.com. And then lastly, we do still have the vaccine white paper. You can download that for free on our website. That has all the information that you would need to look at if you were looking to implement an employer-employee type of program where you would implement that and put it there on site. So thank you again. We look forward to seeing you Thursday.